Hey everybody, it's Dr. Will Cole. I'm live here, actually not in the Functional Medicine Health Center like we normally are on Facebook Live. I'm actually in the beautiful British Columbia this week, visiting the awesome province of Canada. It's so amazing here, so beautiful. So today we're going to talk about intermittent fasting and exactly how to do it and why you want to do it. So we're going to get into all the cool science nerdy stuff in a little bit. But first of all, for those of you that have not joined us before, we've been doing these Facebook Lives, typically on Tuesday, sometime on Tuesday, where we talk about different functional medicine health tips and tools to really optimize your life and bring health into your life. For those of you who do not know who I am, my doctorate is from Southern California University of Health Sciences in Los Angeles, and my postdoctorate education and training is in functional medicine and clinical nutrition through the Institute for Functional Medicine and Functional Medicine University. I'm out of mindbodygreen.com, is one of the biggest and best health websites in the world. They have over 50 million reach and growing. I'm one of their course instructors and wellness experts where I get to teach people around the world about functional medicine, about health. I love what I do. We see patients around the world via webcam consultations. About 75, 80% of our patients are done via Skype and FaceTime in other states and countries, but we're based locally in Pittsburgh, Pennsylvania normally. But the great thing about being a virtual clinic, we can be anywhere in the world and really give people personalized, advanced functional medicine care wherever they're at in the world. And like I said, today I'm in British Columbia. And I think that's everything. We're going to put in the comment section below a full advanced sort of explanation and extrapolation, if you will, of this Facebook Live about intermittent fasting. For those of you who do not know what functional medicine is, go back on our previous Facebook Live videos. It's all on our Facebook page for you to learn more about what functional medicine is. But it's basically, I'll give you an abbreviated Cliff Notes version of it. It is evidence-based natural medicine based on advanced diagnostic testing labs and personalized approach. Another word for functional medicine is integrative medicine. So it really brings the best of Western medicine, which is diagnostic testing in labs from an objective evidence-based standpoint, but the best of alternative health, which is actually getting somebody well. So that's in a nutshell what functional medicine is. There's a little bit more detail than that. So go check out the past videos to learn more if you want to sink your teeth into functional medicine itself. But today is all about intermittent fasting. So guys, if you're watching this live on Facebook or replay on Facebook, just comment in the comment section below if you have any personal questions about intermittent fasting. I will be looking on this comment thread to answer your specific questions. But today, let's talk about it. Intermittent fasting, it's something that I've written a lot about over the years on Mind Body Green, as well as on our website at drwillcole.com. And what is it? It's a time of not eating at all. And why would you maybe recoiling right now? Why the heck would I want to do that? Torture myself. Or it's limited amount of food, like restricting calories, which again, why the heck would somebody want to do that? It sounds torturous. It sounds like a medieval sort of form of torture in prison. But it has a lot of great research kind of linking it to a lot of great health benefits, increasing human growth hormone, and what we're going to talk about today is decreasing inflammation. So this is a great thing because why? I mean, most health problems that we see today are pro-inflammatory health conditions. They have an inflammatory component, or they're just straight out an inflammatory health problem. Anything from cancer and heart disease to autoimmune diseases to hormonal problems, gut problems, brain problems, anxiety, depression. These are all linked to this sort of pro-inflammatory cytokine, which are pro-inflammatory cell activity in the body. So intermittent fasting is one tool that I use in my own life. It's one tool that I use with my patients around the world when it's appropriate. So I think it's good to kind of disseminate this information to give you the overview of how you do it and kind of inform you almost the 101 in intermittent fasting. So, intermittent fasting, I'll tell you exactly how to do it at the end of this video, but for now, what are some health benefits of intermittent fasting? Well, the research really is linking intermittent fasting to a lot of great things. It alleviates brain issues, it almost acts like an antidepressant in decreasing anxiety and depression issues and kind of calming anxiety and depression, which are oftentimes found hand in hand, and dissipating the inflammatory effect. And there's a whole field of research called the cytokine model of cognitive function, basically how inflammation impacts how your brain works. And anxiety, depression, brain fog, ADD, ADHD, autism are all linked to this pro-inflammatory pathway in the body. And intermittent fasting is one tool that we use in functional medicine to really downregulate the inflammatory pathways. So there's the brain. Also lungs. It's been shown to decrease asthma, asthmatic symptoms, and decrease asthmatic flares, and that's definitely something that we see clinically as well when done appropriately. And I'm obviously prefacing the caveat here of when done appropriately, because even healthy things, and this applies to protocols and tools like intermittent fasting and herbal medicines and lifestyle changes and food, what works for one person may not be right for you. So functional medicine is really predicated upon the fact of customizing healthcare to the individual. Intermittent fasting, I'm showing you what the medical literature shows. I'm showing you how it's applied in people's lives, but everybody's different. The next thing would be autoimmune conditions, and that's probably our top patient base via Skype when we're consulting people, or people with autoimmune inflammation spectrum problems, whether it's full-blown autoimmune diseases or somewhere on this inflammation spectrum. Autoimmunity is on the rise. It's sadly, I mean, I have autoimmune conditions on both sides of my family, something I have a real heart for and a passion for. My whole team does as well, and it is a problem. There's over 100 different autoimmune diseases. Another 40, in addition to that, have at least an autoimmune component. Hi, Bestie, I see you. Nice to see you. Intermittent fasting is one tool that we use to really, again, drive down inflammation with people with autoimmune inflammation spectrum issues. So it's been shown to be beneficial with people with MS. It's been shown to be beneficial with people with lupus and other autoimmune issues as well. Yes, Misty, we do see patients with scleroderma, absolutely. The next thing that intermittent fasting has been shown to be beneficial in are people with inflammatory gut issues, people with IBS and colitis, intermittent constipation and diarrhea. This is definitely something that we see beneficial clinically, and in the comment section below you can see the references in the medical literature to the intermittent fasting being beneficial in different trials in different medical journals. Good stuff. Someone's asking here, Claire, hi Claire, would this be appropriate for Crohn's disease? Good time to ask that when we're talking about IBD, inflammatory bowel issues. Yes, I do see the intermittent fasting being beneficial for some of my patients with Crohn's disease. Not everybody, and then how you do it is another variable there, because there's so many ways to do intermittent fasting, and you have to kind of look at the labs, look at the health history, and then one of the best labs is what actually works in your life and what doesn't work in your life. So again, this is something that we spend really our whole the 90% of our work week is spent really monitoring people's cases with them on a daily and sometimes hourly basis, and seeing what works for their bodies and what doesn't work for their bodies, what their body loves, what their body hates. And many people with Crohn's disease, their body does love this in states of intermittent fasting. Some people don't, because you aren't just Crohn's disease, right? You aren't just whatever health issue you are. You're way more complex than just an ICD-10 code. So it may work well for Crohn's, but maybe it doesn't work well for something else. So we have to be holistic in that way, and I don't want to use that term too flippantly, but let's just say comprehensively. So let's talk about inflammation in general. It's an aspect of your immune system. Inflammation's not bad, right? We would be all dead if it wasn't for inflammation, but it's inflammation that's balanced that we're trying to do. So it's subject to this sort of Goldilocks principle, just like with hormones or the microbiome. Inflammation is not too much, not too little, but just right. That's what you need. So intermittent fasting is one way to put the checks and balances, as it were, of inflammation. So most of these health problems that we're just talking about with the brain or the joints with arthritis issues, or connective tissue with lupus, or the gut with the inflammatory bowel issues, etc., we are putting it in check. We're bringing it into balance, where it is otherwise out of out of balance. Otherwise, you would not be having the symptoms that you are having. So here are exactly some ways to do intermittent fasting in your life, some ways to consider, some ways to maybe dig into for yourself and see what's right for your body and what's not right for your body. Number one, the 8 to 6 plan. This is really the easiest way to do it. And probably, I would assume most of you that are watching this video are probably doing this most days and without even knowing it. So it's just eating between 8 a.m. to 6 p.m. That's pretty simple, right? So you're fasting through the night. You're breaking that fast with breakfast at 8 a.m. in the morning. So after 6 p.m. at night, no eating, and until 8 a.m. the next morning. That is one simple way, I would say a very easy way, for people to do intermittent fasting. And yes, that's considered intermittent fasting simple enough. Number two would be the 12 to 6 plan. This is probably most common with people that are trying to do intermittent fasting. I see it most online as far as wellness blogs and health blogs. It's not eating, it's basically skipping breakfast. It's eating at noon, eating between noon and 6 and getting your meals in within that time period at 12 to 6. The next day, the next type of intermittent fasting will be a modified 2-day plan. So you're eating, for this plan, the modified 2-day plan, you're eating clean 5 days and you're fasting the next, you're fasting 2 days within that 7-day period, and you can do a full fast those days or just do a caloric restriction, just kind of limiting your calories to about 700 calories those fasting days. And obviously focusing on clean foods. You can't eat McDonald's throughout the week and think that's going to be beneficial. You can't intermittent fast your way out of a poor diet. Next would be the every other day intermittent fasting protocol. So you're fasting 1 day fully, and then you go back to eating normally the next day, cleanly, obviously, and then you kind of go alternate back and forth, and that would be the every other day plan. And then the 5-2 plan is a full fast, so eating clean for 5 days, and then 2 non-consecutive days you are intermittent fasting fully. So that is another way to do it. And then eating and making sure throughout all these different intermittent fasting ideas, you are eating clean throughout this time. So on your non-fasting days, eat clean, obviously. And then on the fasting days, if you are just calorically restricting to about 700 calories or even less than that, make sure that you are eating clean those foods. So you may be thinking, what the heck should I be eating when I am fasting or when I'm prepping for my fast? We can put in the comment section below some good resources as far as that is concerned to drive inflammation levels down. So we'll be putting those in the comment section below, guys. I think that's everything. I think I covered all the basics of intermittent fasting to sink your teeth into, to get to know about and learn more about. Check the comment section below for a full guide on intermittent fasting, and we'll also put another article when you are not fasting, as well as when you are fasting, what type of foods you want to go for, generally speaking. All right, guys. I hope this was informative. I love talking about this type of stuff. I could talk about it all day, but I want to keep it slightly succinct for Facebook. All right, guys. For more information, you can check out drwillcole.com. We offer free webcam and health evaluations for people around the world to talk about your specific case, to get a functional medicine perspective on what you're going through. All right, guys. Have a great day. We'll see you next time.